I'm always getting asked by patients, what are the new medications to address hair loss? Together we're going to explore Pyraluditimide, KX826. This is a hair loss medication developed out of China. Together we're going to explore how this medication works to address hair loss and whether you should incorporate it into your hair loss routine. Before we get started, I want to introduce myself. My name is Dr. Ross Kopelman. I am a hair transplant surgeon. On this channel, we cover a lot of topics on hair loss and plastic surgery. So if you have not already, please hit that subscribe button and let's get started. Pyraluditimide, which was developed by a biotech company out of China, it's called Pharmaceutical, saw an opportunity to develop a topical non-steroidal anti-androgen receptor blocker. Now, there's not a lot of options out there on the marketplace. We do have DHT blockers like finasteride and dutasteride, and they absolutely decrease floating DHT in the bloodstream, but they don't prevent DHT from binding to androgen receptors. We have minoxidil that helps prolong the growth phase of our hair. And finally, there is an oral medication known as spironolactone that does act as an androgen receptor blocker. However, when you take oral pills, there's the risk of having systemic side effects. On top of that, spironolactone, for the most part, is prescribed only to women, but I do occasionally prescribe it to men as well. So that's another reason why pyraluditimide is very exciting, because it potentially could help men as well as women to address their hair loss topically by specifically targeting the ability for DHT to bind to the androgen receptors. And that's why I'm excited about what's going to happen with pyraluditimide, because it might be used in conjunction with other hair loss medications like DHT blockers or minoxidil. I have to be honest with you, I get very excited when I hear that new drugs are being developed. But I don't want you to be overly exuberant, because we have to look at the clinical trial data. Now, there were 2 clinical trials performed with pyraluditimide, one in China and one in the US. And I want to emphasize something. The FDA has the best standards in the entire world when it comes to drug development. So we have to be skeptical when it comes to looking at Chinese data. Now, the trial in China for phase 2 was 120-ish men who had androgenetic alopecia. They were applying 0.5% pyraluditimide twice a day. They reported that there was an increase in hair follicles by 22.73 hair follicles per centimeter squared. But if we look at the same trial that was run in the US with now about 123 men, they did the same setup with 0.5% pyraluditimide applied twice a day. They also ran a separate trial with 0.25% twice a day to do a comparative analysis. And what they found was you only saw an increase of 10 hair follicles per centimeter squared. Makes me question the Chinese data. I'm not saying that pyraluditimide doesn't have an impact on stimulating new hair growth, but we have to be skeptical. And then there was a placebo group that had no pyraluditimide used, and they compared it to applying pyraluditimide twice a day, 0.5%, and they found no clinical significant difference between the 2 different groups. This led to Pharmaceutical deciding to stop that trial, to classify pyraluditimide as a cosmetic, which allowed them to go to market faster, allowed them to launch pyraluditimide on Amazon and co-work with another biotech company in the US to sell that medication. But they're now going back and they're running clinical trials with a stronger concentration of pyraluditimide, now 1%, and they're applying this twice a day. And it's really undecided yet whether that is going to come back with the data that they really want to demonstrate that it's having an impact relative to a placebo-controlled group that's not applying pyraluditimide on a bi-daily basis. Now, the pyraluditimide that is offered on Amazon says apply once a day. And this is 0.5% concentration. But when they did the clinical trials, they were having patients apply this twice a day, which makes me question, does this actually work? If they were doing it with twice a day and they couldn't demonstrate the results in the phase 3 trial, why would you apply it once a day? How effective is that going to be? Now, maybe if you apply pyraluditimide to the scalp, it could be irritating. So starting by applying this once a day could be the best approach, and then you can up it to twice a day. makes me question whether you should actually consider incorporating pyraluditimide into your routine. It certainly would not be at the top of my list in terms of what I would tell my patients to use. However, with that said, I have plenty of patients who are on DHT blockers like dutasteride or finasteride, or they're taking oral minoxidil, or they're using topical minoxidil, or they're even using spironolactone. I might say, you know what? You want to add something to your routine, you can consider adding pyraluditimide. But I don't think it's going to have a significant impact in terms of preventing hair loss. But it's certainly something that might play a role, but it's not at the top of my list in terms of what I would prescribe to my patients. Now, these are early days. By no means do I think pyraluditimide is off the list. In fact, I think we still have to find the optimal dosage to use this medication effectively. Now, if you're someone who has been using pyraluditimide, you're seeing some great results, please let us know about your experience below. It would be very, very helpful, and I want to learn more. Also, if there are other hair loss medications that you're exploring, you want to learn more about, and you want to see more information about these medications on this channel, let me know in the comments below. If you haven't already, hit that subscribe button, and as always, I'm here on your journey to help you address your hair loss.